This video will cover the focused assessment with sonography for trauma, commonly known as FAST. The information presented is based on Ma and Mateer's Emergency Ultrasound, 4th edition. FAST is a rapid point-of-care ultrasound examination. Its objective is to identify free intrathoracic or intraperitoneal fluid, which is typically blood, in an acute trauma setting. It is integrated into the primary survey for both blunt and penetrating torso trauma. The primary use of FAST is to evaluate blunt or penetrating torso trauma. Key advantages include being non-invasive, rapid, portable, and repeatable, allowing for serial exams if the patient's status changes. The underlying premise is that significant torso injuries often cause hemoperitoneum or hemopericardium. FAST is highly sensitive for detecting free fluid in unstable patients. The goal is to rapidly identify life-threatening hemorrhage, needing immediate surgical intervention. The FAST exam traditionally evaluates 4 dependent areas where fluid collects in a supine patient. These include the pericardial, perihepatic, parasplenic, and pelvic views. This image illustrates the ultrasound transducer positions for the focused assessment with sonography for trauma examination. The pericardial view aims to detect pericardial effusion or tamponade. The technique involves a subxiphoid window, using the liver as an acoustic window. A positive finding is an anechoic space between the pericardium and heart muscle, and it's essential for ruling out cardiac injury in penetrating chest trauma. This image shows the subxiphoid 4-chamber view of the heart. Image A shows the transducer position, and image B is the corresponding ultrasound image. The normal pericardium appears as a hyperechoic, or bright white, line surrounding the heart. The perihepatic view, also known as Morrison's pouch, is the most sensitive area for detecting free intraperitoneal fluid in a supine patient. Fluid collects between the liver and the right kidney, and the scan extends from the diaphragm to the inferior pole of the kidney. These images show the right intercostal oblique view and the corresponding ultrasound images. The liver, right kidney, and Morrison's pouch are easily identified. The right diaphragm appears as a hyperechoic structure. In the parasplenic view, fluid collects between the diaphragm and spleen, or between the spleen and left kidney. The pelvic view evaluates the pouch of Douglas in females or the rectovesical pouch in males. A full bladder is helpful for this view. These figures show the left intercostal oblique view. Transducer position A and corresponding ultrasound image B visualize a longitudinal view of the spleen, a portion of the diaphragm, and surrounding areas. These images display the pelvic longitudinal and transverse views. Ideally, these views are obtained before placing a Foley catheter. The bladder, prostate or uterus, and the lateral walls of the pelvis can also be inspected. The extended FAST, or EFAST, includes a thoracic extension to evaluate the pleural spaces in lungs. Pneumothorax detection identifies the absence of lung sliding, and hemothorax detection looks for anechoic fluid superior to the diaphragm in the costophrenic angles. These figures illustrate the longitudinal view of a normal lung. In image A, the curved array transducer is used, and image B shows the corresponding image with A-lines and the rib shadow. Image D shows a more detailed view using a linear array transducer. Interpreting FAST for the unstable patient. A positive FAST indicates significant internal bleeding, often requiring immediate transfer to the operating room. A negative FAST does not exclude injury. Search for other causes of shock. For the stable patient, FAST is a screening tool. A negative result doesn't rule out all injuries, as hemoperitoneum may take time to accumulate. Next steps usually involve a CT scan for organ-specific injuries. Limitations and pitfalls include false negatives, as FAST may miss less than 100 to 200 milliliters of fluid. It cannot visualize the retroperitoneal space, and body habitus or intestinal gas can obscure views. A negative FAST does not mean no injury. Injuries often missed include hollow viscous perforation, pancreatic trauma, diaphragmatic tears, isolated renal pedicle injuries, and contusions without free fluid. In summary, FAST is an adjunct to clinical judgment. Serial exams are mandatory if the patient's hemodynamics change. It provides life-saving data, but remember, a negative FAST is not a normal exam. It just means no significant free fluid at that moment. Thank you for watching this video. We hope this information helps you study, reflect, and improve your clinical practice.